Welcome back to Fox 43 AM Live. I'm joined now by Carrie Lutz, CEO of the Holton Community Hospital here at the hospital. Good morning.
Well, good morning.
And thank you for welcoming us into the hospital here. Such a lovely building, as I see. And we're kind of chatting about kind of the hospital itself and your role as CEO. So I think the first question is kind of what are the biggest challenges you face as the CEO of a critical rural access healthcare system?
Well, thank you for being here this morning. And I don't think our challenges are unique to what others are facing across any industry. Workforce is probably one of our biggest ones. And then just how do we maintain ourselves as a financially viable organization into the future when healthcare is really under a microscope from a lot of different realms. We're not getting paid more than what we used to, and actually often getting paid less when our supplies and expenses are growing in cost. So those two are really the top two focuses that we are looking at.
And, talking about the financial aspect now, how does Holton Community Hospital manage the financial sustainability, kind of given the unique circumstances in the area?
So we have very, very thin margin lines, and unfortunately, not getting paid for more by health insurance or getting paid at least what our cost is by even Medicare and the government, that has made us look at, okay, what additional services do we need? We are just planning for this next budget year, and we are over twice the amount of gross revenue where we were 10 years ago. But our margins are still very, very thin. So we're just having to bring in more services to offset those added costs and expenses. We are one of the very few hospitals across the state of Kansas that does not receive any tax subsidy, any hospital district taxes. We are a standalone organization, and I'm proud to say that we're able to do that and still maintain our financial viability.
There's so much to keep track of, some of the small margins. You're doing so much for the community now. And I understand you were recently had a trip to Capitol Hill with the Kansas Hospital Association. What were the main objectives of this trip of yours?
Well, the main objective always, and I've been honored and privileged to have more than just once go to the Hill and talk with our legislators. And a lot of times it's about that relationship. Hearing from the people within our state and hearing directly how maybe a lot of times a regulation may come about because of a bad apple, and you don't really think about the regulation per se as how it will impact every organization. You're just wanting to, as a legislator or lawmaker, make a rule that seems to protect everyone. So we're there to say, gosh, have you thought about this? And this is actually how it would impact us. So we were sitting down. 340B was one area that we talked about. Another area that we talked about was the new rural emergency hospital model. Holton isn't looking at that, but we wanted to make sure if a hospital is, and it maybe didn't work out for them, could they revert back to their previous critical access or just regular PPS hospital. So we want to make sure that could happen and talk to them about that. Medicare Advantage plans, I don't know if you've heard at all what the difference between a Medicare plan, straight Medicare versus Medicare Advantage. A lot of our communities, unfortunately, our members are being sold plans that they don't really understand. We really wanted to share to make sure, can they fill out an application? So they very clearly in writing, not just over the phone, choose a plan. Because it may be more affordable, but they're not getting, maybe more affordable for glasses or denture wear, but if they have a stroke and they need rehab services, that service isn't provided. So just giving some examples of things we've seen to our legislators on those different levels or what we were back there for.
Maybe looking a little bit towards the future, how do you anticipate the outcomes of this advocacy? How it will directly affect the Holton Community Hospital?
So there are a lot of different things within the federal level that we could be slated with, the state level as well. On the federal level, really having those relationships, so if an issue does come to light, they remember Carrie Lutz coming and talking it, or they hear from me and I can say, hey, do you remember we talked about this, and this is exactly how it will impact. So developing those relationships and knowing exactly who to go to get our message to was really strong and well received. At the state level, I feel Medicaid expansion has got a lot of varying opinions through the years, and probably is not something that's going to pass this session. I know Governor Kelly really had that in her budget proposal, but it does look like we will maybe look at getting paid more close to par for Medicaid services that we provide. So getting an increase in payment will impact our bottom line. And also there's a provider assessment tax that increases the amount received back to providers for taking care of Medicaid patients. That will also be very beneficial for our organization.
Wonderful. It seems like you have a lot on your plate here. Any final thoughts for our viewers about the Holton Community Hospital?
You know, we are a strong, ingrained organization in our community. We only want to provide the best because we know we're taking care of our neighbors and we're taking care of the people that we'll see in our area where we live and work. And we are only wanting to provide the top quality care with that compassion to our community. And we have such a giving community. We really appreciate that. We've got a highly paid board. They volunteered their time for years and years, and very appreciative of that. They also want to see this organization here for years to come. We've got a foundation board that also sole mission is to help support the hospital. And we've had a lot of people sit on our patient and family advisory council. So that's something to where we run any policy by or new procedure, new service line by our community members, and they're very engaged in that. So if you would like to get involved with our hospital, there's multiple ways to do that, and we would love to connect anybody in our community with that.
Fantastic. Well, Carrie, thank you so much for welcoming us into the hospital this morning.
Sure.
It's been a pleasure chatting with you, and thank you for the work you're doing and the advocacy you're doing for the community in the area. I'm sure, you know, we're seeing the developments of it as we speak.
Sure.
And of course, everybody, if you want to learn more, head on over to holtonhospital.com.